Acetone, methanol, and hydrous ammonia.
There you go.
The ingredients sound like a mad chemist's cookbook. But in fact, crystal meth is a mix of common cold medicine and household chemicals. But while many of the ingredients can be found at your local drugstore, making meth can be highly dangerous, combining combustible chemicals in less than ideal conditions. The results can be explosive. People who make the drug take their lives into their own hands, and there can be serious risk for those trying to stop them.
Guys ready?
Just about.
Scientific research has proven that entering a meth lab is like walking onto a hazardous waste site. Today, more and more police wear protective gear, but that's a far cry from how it used to be.
Oh, it was the ultimate rush to go into a lab, kick the door, run in and throw people down.
Your hands behind your back.
We were 10 foot tall and bulletproof.
Kelly Call was one of many police officers working narcotics investigations in Utah in the 1980s and 90s.
Check the back door.
Open the door now!
We would run in. First guy in would make sure nobody was in the lab. We would start unplugging cookers. We would open windows, then run out and catch our breath.
It's called air out before you pass out. One unlucky police officer is assigned to open the door, run through the lab, open every window, and run back out while still holding his breath.
Charles Ilsley, a forensics expert who investigates meth-related cases, was an undercover narcotics officer in Utah in the early 1980s.
You walk out moments later with a severe headache and ears ringing and dizzy for hours after you've left the lab.
Your tongue would be numb, or you'd have a soreness in your throat. Some guys had blurry vision.
Robbie Russo figures he was in about 100 labs during the 1980s and 90s.
The odors in the chemical were so strong, I remember going home, and I would always undress in the garage, but I remember taking off a shirt, and the shirt would shred, you know, from the chemicals, like if it was exposed to battery acid or something, and it would shred. I remember coming out the next day, and my tennis shoes were, you know, separated and apart.
We went in, no protective clothing. We were lifting items, smelling them, handling them. We had no idea what we were dealing with.
To give you an idea of how little attention was paid to safety, police officers were taught to waft, where you hold a chemical container in front of your nose and with the other hand intentionally waft or wave chemical fumes into the nose so you could do a field test or form an opinion about what the contents were. Frightening part is that was stressed as the safe way.
But it was anything but safe.
That's just extremely dangerous. And sometimes some of these chemicals, just one quick breath like that can cause irreparable harm.
Not only that, but nationally renowned scientist John Martini has discovered that merely being in a meth lab unprotected is dangerous.
What we really determined was that if you're a law enforcement officer and you have the unfortunate experience of walking into an actual ongoing cook, that you will be exposed to airborne levels of chemical that will and can cause you significant harm.
While research has proven that meth labs pose an immediate threat, there are no studies on the effects of long-term exposure. But narcotics officers in Utah believe they've found out about meth's long-term hazards the hard way.
Debbie Dujanovic continues an Eyewitness News investigation.
Tonight, the number is growing. We've now confirmed 40 of 58 Utah officers who investigated meth labs are sick, have cancer, or have died.
In March 2005, Debbie Dujanovic of NBC's Salt Lake City affiliate learned that several former narcotics officers in Utah were suffering from unexplained illnesses.
We just cold called several of them and said, "How's your health?" Funny you should ask. Let me tell you, I've got esophageal problems, I've had an autoimmune disease, I have asthma, I can't breathe, heart attacks, strokes, cancers at the age of 30. It was just overwhelming.
In the last 5 years, I've made 11 trips to the hospital, 3 heart attacks, 4 angioplasties, procedures involving kidneys, pancreas.
First of all, it was, my gallbladder, and they took it out and said, there was something strange with that. And then I started having what they thought were kidney stones and chronic coughs. And eventually it evolved into, kidney cancer. And they removed one of my kidneys.
My health has really declined. I think I'm older than I should be. My body's older than it should be.
Kelly Call is living with a precancerous condition in his throat. While there are currently no studies attributing chronic disease to long-term, officers believe that years of working in these toxic conditions have caused serious health problems.
It leaves me with a feeling of anger, frustration. Had I known that my exposure to methamphetamine and the labs would have caused these problems, not only would I have not gone into them, none of the people I worked with would have gone into them.
There's always you always wonder if it could be something else, and it could be, but I would put my money on the exposure, and I'm 90% sure that that's what it was.
And officers also suspect some cases of exposure have been even more serious. Russo also worked narcotics with Gary Sterner and his wife Kelly Nye Sterner during the 90s. Kelly logged many hours in the evidence room sorting caustic meth ingredients. Her husband says she often coughed and choked on the fumes. Kelly was diagnosed in late 1999 with mastocytosis, a rare cell disease.
Her liver grew to 3.5 times its normal size. Her spleen grew to 3 or 4 times its normal size. They had to remove her gallbladder. They had to remove her spleen because it was too large. And then she finally had kidney failure.
She died in January of 2005. She was 49.
I would have liked to spend a lot more time with her. It was too short. We were only married 2 years. We were together for about 5. We were married for 2, but it seemed like it was still the honeymoon stage. Still very much in love.